Welcome back. Now, President Cyril Ramaphosa has signed the National Health Insurance Bill into law, initiating the government's highly debated plan for universal health coverage. This action takes place just 2 weeks before a general election, where it is anticipated that the ANC may lose its majority for the first time since gaining power in 1994. And joining me now to unpack this pivotal move in SA's constitution in greater detail is BUSA CEO Cas Coovadia. Thank you so much for your time, Cas. Cas, would you say that South Africa at this point where the economy stands is just not ready for national health insurance? Or is it just this type of NHI in its current terms that just does not fit?
Well, we think the NHI Bill in its current form is not workable. We've been absolutely clear over the last few months as we interacted on this and worked on this, that an amended NHI Bill that crowds in the private sector and enables an environment where the public and private sector can work together to sustainably put our country onto the path toward universal healthcare is workable. And all the inputs we've given, substantial inputs to Parliament and the National Council of Provinces, suggested the amendments that need to be made and why they need to be made and what the impact would be. So we're still in that position. We did express concern that the bill had been signed just 2 weeks before elections in its current form. We note that the president has said that he's signing the bill, but promulgation and implementation will take quite a long time. And so we hope that we can still engage and arrive at a piece of legislation that sustainably introduces universal health care.
It's actually quite interesting, Cas, because there's been a narrative that the private sector is in opposition to this because it wants to be left alone. But you're saying that actually the private sector is actually willing to take up responsibility and participation so that it is part and parcel of the NHI, but in a way that benefits the public sector and the private sector.
Absolutely. I mean, we've been at pains to say that the private sector we can't have a healthcare system that benefits a few, even though the private healthcare system is broadening its representation. But majority of our people are still languishing in public healthcare that's just not working. So we're absolutely clear that we believe, just as we're doing in the areas of logistics, energy, and law and order with government, where we partnered in government, and we're beginning to see good progress. We can do this in healthcare as well. It would be irresponsible of the private healthcare sector to say that we're not interested in universal healthcare. We are absolutely interested in universal healthcare. As I said, we believe the bill, if appropriately amended, can put us on that road. But it's not a quick fix. We need to, because in many ways, this is a money bill. Government needs to tell us where they're going to get the money from. We don't believe we have the money. But if we utilize both the capacity and skills and resources in both the public and private sector, we believe we can sustainably have the resources to move towards universal healthcare and not depend on the fiscus only to actually provide the funding for it, because the fiscus just doesn't have the funding.
It's quite interesting that you say that this is a money bill, and of course the questions have come around that, how would government even fund this? Is there just no communication, no clarity in terms of how the government would be able to fund this? And essentially, the private sector is worried that that would fall on the public?
Yeah, so we have significant problems in our country, all of which need to be funded. I mean, and not necessarily additional funding, but more efficient use of funding. We also have a social net in our country that is good, but the social net needs to be looked at broadly. So how do we fund, for instance, old age grants, child grants, healthcare, education, other range of social services, how do we ensure that we have a comprehensive social net, and how do we fund that? And in our view, the best way of doing that is increasing partnerships between the public and private sector. And so in healthcare, we've been saying that if we send out a message that says that both the public and private healthcare sectors are serious about universal healthcare, we both appreciate that we need to ensure that the majority of our people have quality healthcare. And we're going to work together to utilize our resources to achieve that over a period of time. It actually sends out a message to investors that we are serious about healthcare, which then has a positive impact on employment and on economic growth. And that's the sort of message we need to send out. Instead of sending out a message that says that we're crowding out the private sector, that government will be solely responsible for where people get their healthcare, how they get their healthcare, and will be managing that through a single fund. I mean, we already saw yesterday, for instance, Discovery's shares taking a knock.
Yeah.
In all the discussions I've had with investors, they've expressed serious concern about this piece of legislation in its current form. And we really don't need to send out negative messages to investors at this point in time.
Well, there's also the message of unconstitutionality. And from your side, what are you picking up that is making this NHI bill in its current form unconstitutional? Who does it prejudice?
Sorry, who does it?
It prejudice.
Well, it undoubtedly prejudices the private healthcare sector, and unnecessarily, we believe. We can actually utilize those resources, as I said, to achieve our objectives. I think there are competition issues with the state, with a single fund, and the state being the sole player for health issues in the country. And then there's been issues related to, so the way the NCOP, for instance, dealt with this. The role of the NCOP is to listen to provinces, take provincial views into account. There were at least 3 provinces that had problems with the bill, and the NCOP didn't take any of those into account and simply sent the bill back to Parliament with no amendments and then went to the President. And we believe that if we going to implement this, as the President said, over a long period of time, then let's relook at engaging, and let's see if during this period of time we can actually arrive at a piece of legislation that works, that is sustainable, and that optimally utilizes the resources and skills we have in this country. And we're more than happy to engage on those. A number of organizations have indicated that if the President signs before election, they'll take government to court. Now, that could sit in court for years. And that takes healthcare back significantly. So if we can resolve this, and if we can arrive at a piece of legislation that works for the country, which means that works for the entire healthcare system, then we're prepared to engage. If government is not prepared to reconsider or look at serious flaws in this bill, then we'd have to consider our option.
It does seem like it is going to be a long road, and I guess maybe things will be much clearer after the elections. Thank you so much for your time, Cas. That was BUSA CEO Cas Coovadia.